calls to ambulance call centres went unanswered. So not just a problem of ambulances not turning up, which of course is well publicised, but not even getting your emergency call answered, and so on. But at the same time, Wales spending money, of course, yes, you've guessed it, on international relations and diversity. And let's talk about this in some more detail now with Jamie Jenkins. He's the former head of health analysis at the ONS. So Jamie, a man that likes facts, that's good.
Good morning, you okay?
Yeah, good morning. Very, very well. Happy New Year to you. Let's talk about the problem that is Wales then, particularly when it comes to the NHS. All sorts of issues, but particularly in terms of, it seems there, could we say, misallocation of funds? I mean, they've decided to spend £8 million on international relations. They've also decided to spend £135,000 on a project that supports the delivery of their anti-racist Wales action plan, but they can't answer the phone in their ambulance call centres.
No, and it's shocking. And you've got to remember what devolution is there for. It's to run Wales. So Wales shouldn't really need to have an international department because we've got a UK government to look at the international stage for us. So why Wales is getting involved kind of on international matters is beyond me. And the devolution, obviously, remember when Tony Blair brought this in many, many years ago under the previous Labour government, what it does allow you to do, Russell, is do things differently. And they've criticised the Conservatives for the last 10 or 12 years, the Labour Party, in terms of the running of the NHS, where it's been run under a Labour Party in Wales now for the last 25, 26 years. And
how's that going? How's that going, Jamie?
Yeah, and what we've ended up with is much worse outcomes. So we've got worse waiting lists than we have in England. And obviously, when you adjust for the population, they still come out worse in Wales. And a stark reminder of that is if you look at people on waiting lists in England and you compare them to Wales, for example, and the number of people on the waiting list who've been waiting over a year. Now, in England, at the moment, it's around 3.3%. So of all the people on the waiting lists, 3.3% have been waiting for a year or more. In Wales, on the numbers on the waiting list in Wales, it's 23.3%. Massive numbers compared to England. And so, really, if Wes Streeting and Keir Starmer, when they were doing the election campaign, saying they've got all these plans for the NHS, they've had ample opportunity to trial and do things differently in Wales.
Well, they should have looked at what was happening in Wales under, Marcus Rashford, for instance, obviously the former head of the Welsh Government. They should have looked at that and done the opposite, shouldn't they?
Oh, of course, things haven't gone good in Wales for a long, long time. And you're right to call out some of the nonsense that the spending in Wales is spent on. It is absolute nonsense. And the things that really call into question as well is the ambulance calls over Christmas as well. There's some shocking statistics there that people aren't getting their ambulances kind of calls answered. And the big issue you've got, and this is an issue in England as well, let's just paint this as about Wales, but you can look at the NHS overall, and it happens every single winter, ambulances stuck outside hospitals. And how many governments have talked about reforming social care? Because what you've got there, Russell, is ambulances turn up, they can't put the patient into the hospital because there's no beds in the hospital in the A&E, because people in A&E can't be put on wards, because people on wards can't be discharged into the community.
And this is not really a problem of, let's be honest and clear here, this is not really a problem of money and resource. This is such instances that you've just highlighted. That's a problem of organisation, surely. The fact that they can't get people out of hospital into, whether it be social care or elderly care or just back home efficiently enough, means that you end up every winter, and it does tend to be winter, almost as if winter arrives as some kind of surprise to the NHS, Jamie. This happens every single year. It's a question of organisation and inefficiency.
I think you're spot on there, because we think that the social care system is separate from the NHS. So NHS managers and aren't going to fix the discharge problem because that's somewhere else. And if you remember when Theresa May tried to reform the social care, and then a couple of years ago when she went into the election and lost the kind of majority that she had, governments don't want to tackle this one. They don't want to put more money in by perhaps taxing elderly people more and things. And there's different ways you can look at the funding of social care, because we always seem to find money, as you've been talking today, for all the migrants who are coming over on small boats. Or
£8 million a year to run £8 billion a year to run the asylum process in this country. But let's also be clear that Wes Streeting has announced another £20 billion into the English NHS over the next 2 years. I don't have a lot of confidence that, given that most of these problems are organisational, that money's going to make any difference at all.
No, what we want there, Russell, is ideas, not money being ploughed in, because there's record money going in all the time. What you've got to remember as well is that, we're an ageing population. One of the successes in the Western world is that, life expectancy has been improving over the last 20 or 30 years. We've got a large cohort of people born after the Second World War, those baby boomers, hitting that point in time where the demand on the NHS is going to go up. And ultimately, with the population growing through migration as well, we're going to need more resources in the NHS. But just pumping more and more money in, I can guarantee we could have a conversation next December, next January, about all the problems with ambulances stuck outside hospitals. So
we're going to have the same issues. Well, look, there is more money in the NHS, not just this government that's decided to put more money in, but the previous government, the Conservative government, allocated more money, and it's made absolutely no difference whatsoever to outcomes, whether it be remedies, whether it be waiting lists. And of course, we've also seen in the news today, and this might be part of the problem, and quite how you solve this, I don't know, and that is that we as a population don't help ourselves, of course, when it comes to the NHS. It's reported that obesity treatment in the NHS has quadrupled in just the last decade. So those being treated for obesity-related conditions up fourfold in just 10 years. Now, we used to think that, alcohol and drugs and so on were one of the biggest problems facing the likes of A&E, but it seems that increasingly now the NHS is under pressure because people are too fat.
No, totally. And if you just remember a few years ago during the COVID pandemic, one of the biggest risk factors for being in critical care if you had COVID was actually being obese. And so the NHS does need to help tackle this. But I think you alluded to it in the introduction there. It's not about fixing the problem. Prevention is an important part of this as well. And
how do we do that? I mean, because, there's lots said about educating the public and, to live better. But I'm afraid some people just aren't willing to be educated, coerced or persuaded to live better. And I guess with kind of 25 takeaways on every high street, microwave food and, lazy eating being prevalent in the UK, there's not much chance, I think, of certain people, certain demographics in Britain, immediately changing lifestyle to save themselves and indeed to save the NHS. What do we do?
No, that is a very good point there, Russell, in terms of that. Obviously, the government are talking in terms of banning kind of junk food adverts, but that's not going to
make any difference. So it's a bit like Sadiq deciding not to allow anything that contains sugar or salt to be an advert on TfL tube lines and bus stops. I mean, that's absolutely pointless, ridiculous, and will have no difference whatsoever, make no difference whatsoever when it comes to, again, certain types of people that are just going to act and behave in the way they do. I mean, we're kind of missing the point. I mean, do you think, for instance, is there argument in subsidising gym membership, for instance, making a healthy lifestyle more economically and financially attractive to the population? I mean, do we think that we should take prevention much more seriously than we do cure?
No, I think so. And talk about gym membership there, one of the simplest things you can do actually to try and get a little bit fitter is just go walking. It's free. You can go outside and do that, and that will help in terms of things. I think when you talk about education, maybe we just need a bit more education on the consequences of obesity, because people don't realise, obviously, until they're later in life when they perhaps need that medical intervention at the NHS of what the impact of obesity is. Yeah. Perhaps a bit more education around what the impacts will be in the future is a part of the solution to this.
The other thing that we should talk about, of course, we've only got a minute or so left, but is the problem of strikes in the NHS really not helping outcomes, not helping treatment. News today in the Telegraph of a lady by the name of Susan Evans, who was 55, who died as a consequence, it seems, of neglect on the basis of her weight loss treatment because she was misdiagnosed, or rather not diagnosed, at the time of industrial action by junior doctors. The coroner said that there was no specialist weight loss nurse on duty and that Miss Evans was not seen by a senior doctor. She was discharged despite being extremely unwell and died shortly afterwards. We've been talking on this channel, and I know this won't necessarily be your specific area of expertise, Jamie, but we have been talking a lot on this channel about those strikes back in the kind of spring, summer of last year, that those strikes by nurses and doctors would result in deaths. And it seems that that definitely has been the case, doesn't it?
Yeah, and this is a tragic story, obviously thoughts out to the family. And yeah, and this individual got discharged from hospital when the strikes were on. So there was a lack of care there, didn't see a doctor. And then I think 48 hours later was readmitted into hospital with complications from some surgery. So you talk about prevention and cure. That's an example there where having the right level of staffing in the NHS at the time may have resulted in this poor lady.
Well, it looks like it has. It looks like it has. OK, Jamie, many thanks indeed.